what are the differences between a fresh and frozen embryo transfer? In an IVF cycle, eggs that are retrieved from a woman are fertilized in the lab using sperm from the male partner. The embryos that are formed can either be transferred back into the uterus right away, known as a fresh embryo transfer, or they can be frozen for later use. The frozen embryos can be transferred to the uterus anywhere from a month to years later, and this is known as a frozen embryo transfer. For both fresh and frozen embryo transfers, the initial steps are the same. Medications are used to stimulate the maturation of multiple egg-containing follicles. The eggs are then retrieved from the ovaries, and these eggs are fertilized in the lab to create embryos. In fresh embryo transfers, the transfer happens from 3 to 5 days after egg retrieval. Some of the advantages of a fresh embryo transfer are that the transfer happens during the same cycle as the egg retrieval, and so it has a potential to provide a faster time to pregnancy. And the second is that usually they require only one round of medications. Some of the disadvantages are that in a fresh embryo transfer, medications need to be continued for a longer period of time, and this can make women more susceptible to developing ovarian hyperstimulation syndrome. In some cases, medications that are used to stimulate the ovaries can make the uterus less receptive to implantation. And lastly, fresh embryo transfers don't allow for the pre-implantation genetic testing of embryos. For frozen embryo transfers, the transfer can take place anywhere from a month to years after egg retrieval. Some of the advantages of a frozen embryo transfer are that there is a lower risk of ovarian hyperstimulation. It allows for pre-implantation genetic testing of the embryos so that the healthiest of embryos can be chosen for transfer to the uterus. And it allows women to preserve fertility in cases when they are not ready to be pregnant and want to save the embryos for later use, or in cases when women expect to undergo cancer treatments or certain other treatments that can negatively impact their fertility. Some of the disadvantages of a frozen embryo transfer are that multiple rounds of medications are required. First, to stimulate the ovaries, and then again to prepare the uterine lining. Secondly, it can be more expensive to freeze and thaw embryos. And there is a greater wait time to pregnancy after egg retrieval, which in itself can be stressful. There are no significant differences between the success rates of a fresh versus a frozen embryo transfer. After reviewing the specifics of your case, your fertility doctor can recommend the best options for you.